I am Dr. Colonel Atul Bhandari. Today I am going to speak about the rising cases of heart attacks in school children due to stress and other factors. First, I will mention the causes and then the remedial action. The causes are as follows. At number 1, there is a high stress level being put on the shoulders of the child, primarily by the academic process and by parents. Parents need to understand that it is detrimental and counterproductive if they put excessive pressure on the child that he or she must score very high marks. Next, lack of sleep. Now, parents somehow feel that the child's body clock is somehow similar to their own body clock. For example, if a parent feels that they themselves feel sleepy at about 11:30 p.m., so they presume that the child also feels sleepy at about 11:30 p.m. This is incorrect. What is correct is that the child needs about 15 to 20% more sleep than we adults do. For example, a child in middle school should be sleeping about at least 9 hours. Now 9 hours in bed is equal to 8 hours of sleep, because it will take about half an hour for the child to sleep and about half an hour on the child to get up. So, if the child has to get 9 hours of sleep, he or she must get 10 hours in bed. Next factor is that there is total lack of relaxation. The child goes to school, comes back, and has hardly any time to rest or unwind or relax or have some downtime where he or she does whatever they want to do. The schedule is so packed that they have to do A, then B, then C, then D, and finally go off to sleep. Next is not having a sufficient diet which is of good use to the child. For example, there are some healthy things which children must have, but this is often ignored by parents, and the child is fed on soft drinks and colas and chips and fried foods, leading to obesity. So this is also caused a factor. Next is excessive pressure from their peers, etc., to get on to better things in school, better things in games. So the parents must be aware of this peer pressure also. Next factor is that the child does not get enough in tune with music. Now, music is known to be a very good relaxant, but this is somehow nowhere on their schedule. Now, the remedial steps. The first is that the parents must realize that they must be key agents to reduce stress on the child, because unless they are aware of the issues, how will the others be? They must ensure the child gets sufficient sleep. They must ensure the child gets a good diet, has time to go out and play, spend some time with friends, do some activity which is enjoyable and safe, where they can unwind and relax and have some downtime. It is not necessary that the child must always be studying or doing something. It is not necessary that they must have a very fixed routine. Give them some flexibility. Next, the parent should also ensure that they have a message to the child which the child can sense, that their love for the child is unconditional. It is not dependent on the number of marks he or she scores or in which position they stand in a race, first, second, third, or whatever. They must show that the love for the child is unconditional. It is not connected to these issues. So please ensure that we have a healthy lifestyle for our children. They go to bed on time. So in summary, I would like to say that ensure that the stress level being built up on the child's shoulders is decreased drastically. They must go out and play. They must have a healthy diet. They must have a lot of support from family and friends, and they must get enough sleep. We want our children to be healthy and have long lives.